My name's Katie Oliver. I'm the Enhanced Recovery Facilitator and I'm an occupational therapist by background. The role of the Enhanced Recovery Facilitator is to promote patients to be up and mobile early in their admission, to promote independence while they're in hospital, to encourage good fluid and food intake, to ensure that our patients are involved in discharge planning and decisions about them, and to really promote the patient journey through the hospital to reduce length of stay, to reduce the risk of complications, and to support a patient to get home as quickly as possible. The Dress for Dignity campaign is an initiative which was introduced within the hospital to promote our patients to be wearing day clothes while they're here. The initial ideas were for our patients to go home dressed in day clothes, and then it expanded from there to the point now we have a Dress for Dignity cupboard, which is based on Hurley Ward, and then we're opening a second one down in inpatient therapies for ease of access of the clothes. There was a nationwide campaign back in the summer called PJ Paralysis, which really supported the Dress for Dignity initiative in the hospital. The idea was that the patients were encouraged to wear their day clothes while in hospital and get up out of bed. The benefits of this for the patient are to re-engage in their routine, their daily routine, as quickly as possible while they're in hospital, and to also reinstate a sense of identity for them. While they're wearing their own clothes, it reminds them of who they are and what they can achieve. For family members, it helps them to move away from seeing their loved one as a patient to that of mum and dad, and to really see them back home and being able to manage when they're there. From the staff, it gives us a common language for us to be able to challenge the culture of our patients wearing hospital pyjamas frequently while in hospital. And as a trust perspective, it helps to reduce the length of stay and to reduce the risk of pressure sores. The impact of the patients, they often don't believe what a difference it can make for them to be dressed in their own clothes compared to hospital pyjamas. So for someone who is more able and better, then they will see the person next to them in the same pyjamas and they will associate that sickness and being unwell with the hospital pyjamas. However, when they wear their own day clothes, you can see they'll tend to be more encouraged to brush their own hair, even brush their own teeth, and they'll sit that little bit taller by wearing their own clothes. And actually from a staff perspective, we look at patients differently as well when they're wearing their own clothes. We again see them more as a person sitting in their living room rather than a person who's sick in bed, and I think that makes a really big difference in terms of the opportunities that we give them and the opportunities that family give them, and actually the way in which the person sees themselves.